Hey everyone, happy Saturday and welcome back to another Saturday live stream with Contempo Coding. I'm Victoria Moll. I'm a medical coder, auditor, educator, and content creator, and I'm here for you guys just about every Saturday to answer some questions that you may have about medical coding industry, about how to find a job, about how to navigate different specialties, your career advice, even things on exams and testing strategies. So feel free to say hi to your friends in the chat, and let's just go ahead and we will start out with the stream. I can see the comments coming in already. So I'm saying hello here to Shayna, Marissa J. Glad to see you guys here today for the AMA chat. Ask Me Anything. Amaryllis, good to see you here. Monica as well. So I've been working on a few things. First off, I want to say congratulations to our new members. So Marietta and Deanna, thank you for becoming a YouTube channel member. Greatly appreciate those of you that have joined the channel membership. Hey, so if you haven't already, I do, just a FYI, have a channel membership. Channel members are tiered from $1.99 to $9.99 a month. Everyone gets access to community-only posts, custom emojis, and at the gold and platinum levels, which are $4.99 and $9.99, you can actually get access to have your name at the end credits of my videos, and the platinum members get behind the scenes footage and custom videos. So that is an option if you're interested in supporting me and the channel and the content that I create. Hey, so hey from Kentucky. Hey, Jamie, good to see you in here. So I'm going to actually first get into an update because I saw a comment come through that's going to feed right into this update. What I've been working on right now, actually late into last night, I was working on getting some of the 2022 ICD-10-CM updates together. And I was planning on putting it all together in a webinar, but I think what I'm going to do is not only make a free webinar out of it, but I have that whole video of the entire ICD-10-CM guidelines. So I'm going to take that portion where I talk about the guideline updates, post that up on YouTube, and then there's also going to be a complete 2022 ICD-10-CM updates coming up. So there is a comment or question that came in here. Is there any new guidelines for COVID ICD-10 coding for 2022? There are a couple of COVID updates. They will be coming for October 1st of 2022. I haven't had a chance to dive super deep into them, but I'm hoping that starting next week, I will have them within the entirety of the 2022 ICD-10-CM updates that I'm going to be doing. There was both some guideline updates, plus I believe at least one new code pertinent to pertinent to COVID-19. So that is up and coming. And I am going to be making that free for anyone who wants to partake of the webinar. That should be up on the website, hopefully next week. Pam, hello. Hi, hello from Kentucky, and then Arizona. We also have some members here. Carmen, good luck to you with PCS. I've got my PCS book, and I haven't just had an opportunity to get into it. It's been kind of a crazy couple of weeks for me, to be honest. Says, awesome, thank you. I know there were some codes. I'm interested in the webinar as well. Yeah, so I'm going to make sure that I get all the information up as soon as that webinar is available. Like I said, I'm just about done with the guidelines portion, and then usually when I do my updates for ICD-10-CM, I start with the guideline updates, which some people skip. They forget to even go over, oh yeah, some of the guidelines updated. They focus more so on what was new, deleted, and revised. So I'm going to go over the guideline updates and then go over the codes and then the rationale for why certain codes are revised, deleted, or were added as well. So to give a whole picture of it. So I like to one of my favorite things about doing updates is a lot of times when people do ICD-10-CM or CPT updates, they're like so incredibly dry. And every year I try to challenge myself, like, how can I take something dry as annual coding updates and make it something a little bit more palatable? So that's one of my big focuses. Hey there, good to see you here on the chat. I have not seen your name pop up before, so hello, hello, if you are new. Yeah, it's a great Saturday here. Yesterday was stifling hot, stifling hot. It was, I believe, close to 100 degrees here in Pennsylvania, so it was a little crazy. So Christina's in here. Christina is saying hello from Arizona. I passed my CPC last week. Your videos helped me to get prepared for the exam. And thank you. Well, thank you, Christina. I am glad that I was able to help you out. So you passed your CPC. Congratulations. That's exciting. So definitely let me know, what are your next steps now? So are you already working in healthcare and now you're making like the transition to a coding department? Are you totally outside of healthcare and you're now starting out into your job search? Definitely let me know so I can see what I can help you out with there. Yeah, so Pooja, the webinar that I'm going to do is going to be on demand. I actually, you know what, now that I think about it, probably need to submit it to the AAPC, but I can usually get those expedited. So that should be up by hopefully for the end of the week. So yeah, I'm going to be doing it 100% on demand. Da, da, da. Destiny Fate says, hey, I love all your videos. Thank you, Destiny. I appreciate that. That was a very sweet comment. Danielle, how do you get the education part? So do you mean education part as far as if you're looking to become a whole medical coder and you need medical coding education, or are you talking about continuing education? If you could clarify for that for me, I can see what I can do for you, because those are going to be two different answers. What are we doing? Da, 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 da. Angel is asking, hello, Victoria. I will be taking my CPC exam on September 18th. What should I be focusing mainly on during studying? Your practice examinations. So the practice examinations are your best bet at evaluating your readiness for the exam. So work on your practice examinations and see how you're doing. If you're getting generally about an 80% on your practice exam, that's usually a good indication that you are more likely to pass the actual examination. Some people say that the practice examinations are harder than the exam. Some people say that they are not as hard. But the thing about the protocols for how they develop the questions, from what I understand of the exam process, from watching things like the different social hours that AAPC has, is they have people that just make questions. They just make professional fee coding questions. They don't know if they're going in study guides, practice exams, the actual test, if they're going in the book. So it's kind of a whatever ones happen to generate in your exam. So some people may on their practice exam get easier questions than are on the exam, or vice versa, because it's just basically a giant bank of questions they have, and some of them may go certain other places. So focus on those practice exams. The rationale is a huge, huge key though as well. So look at the ones that you're maybe not clicking as well with, or you didn't get correct, and focus on those areas. So look at them and go, am I maybe not understanding anesthesia? Am I maybe having trouble missing certain things that they're asking me? And just doing those practice exams, especially some of the longer cases. One of the tactics that I always like to discuss when I'm talking about medical coding is the fact that everything for the exam has the exact same points values for the AAPC CPC exam. So if you get a 5-page operative report, it has the exact same points value as something that's just a simple med term question. So save those for last when you're taking your exam. And then at the end, when you get those 5-page op reports and you have the time for them, look first at what they're asking you for. Because if they're just asking you for like a diagnosis code, make sure that that's what you're focusing on when you go back and read that report, that you're not trying to pull procedures out of it. And then you get to the question and it's just asking you, well, what are the diagnosis codes? So Chi-Chi says she is new here. May I ask where to start? That is a great question. And I actually have the perfect tool for you as far as direction on where to start. So on the main channel of my website, and I'm pulling it up right here now on my second monitor so I can show you guys on the main channel of my website. Let me make sure. There we go. So over here, oh, hold on one second. I got to connect it over. Membership, alert box, cam screen, right, hold on. Chrome settings. The one thing I forgot to do. There we go. So if you look over here on the main channel website, there is an entire playlist that I have built just for people like you that are looking into getting into medical coding and they don't know where to start. So if you go right here, the very first playlist is, do you want to become a medical coder? Start here. And this is where you need to begin. So this is where you can start. How to become a medical coder, the difference between medical coding and billing. So this is a very easy to watch, bingeable. It talks about salary. It talks about the costs associated with medical coding so that you can make the right decision if this is the career for you. I never want to push anyone into becoming a medical coder. I never want to tell you this is the greatest job ever and you should absolutely 110% do it. I like to give the information about this is what medical coding is. These are the expectations. You can maybe do this or this. It might not be as easy or likely to find something like a job where you can immediately work remotely and you can have your kids at home, et cetera. They do exist, but give you those realistic views, tell you what it's all about, and then you can make the decision if this is the right career path for you. And I do have recommendations as well. If you are currently looking to get into a program, I have an affiliation with onlinedegree.com. And what they do is they have a quiz that they've built specifically for my viewers. And it asks the same questions that I would ask you. Where are you located? How much are you looking to spend on a program? Assumedly, you're looking to take it all online. How soon do you want to be finished with it? And they will take that quiz, compile your results, and direct you to an accredited program that is good for you. So you never have to worry that it's going to be some fly-by-night school that's going to close in 3 months or that you're not going to get appropriate support. They have all the information prepared and all of the tools ready for your success. So you can also be potentially eligible for additional content, additional discounts, or additional things like maybe even books shipped to your door, but only if you use my link over here, go.onlinedegree.com/Contempo. So if you're interested in a program, they will absolutely, like I said, ask you the same questions I would, and they know the best accredited universities, colleges, and programs to get you into. And just one second, I need to get myself standing up because I'm slouching just a little too much for my like today. We're going to move. I got Scrooge McDuck on my shirt today. How do you guys feel about that? So interesting. I'm actually, I'm a little high now. Hold on one second. Move me up just a smidge. So interesting side note here today. I'm currently working on building a new desk for myself. So right now I work on a laptop. The laptop is a gaming laptop, and it was basically built to handle a lot of video, but it was the fans on it are really loud. So I don't know if you've ever noticed, but in some of my videos, you can hear this like dull hum in the background, and that's my microphone picking up the fan on my laptop. So I'm looking right now, I have my boyfriend who's an engineer pricing some things for me to get a tower instead, and then mounting my monitor. So I might be once again kind of changing my setup here for things, and that might free up some space for me in the live stream and my document cameras and everything as well. So I'm really excited about that. So that might be cool. Christina saying, I studied in my community college. It took 3 semesters of full time to finish the program. That's about what it took for me. So I'm a proud community college girl. I went to Reading Community College in Reading, Pennsylvania, and I did a certificate program. And I believe it was about the same. It was about a 9-month program, which is about the same. It's about 3 semesters. Excuse me. And finished in 9 months. And honestly, I just took every opportunity I had and ran with it. Anytime someone had an extra project or an extra, assignment, or they wanted me to cross-train in a different department, like that's really the important focus, is making yourself, as my friend Tony L. Holmes referred to, that go-to person, the one that everyone can go to and say, I need help with this, this, and this. And you can make yourself that person who's I don't want to say irreplaceable, but less likely to be replaced. And then, of course, just continuing to learn. I apologize. This camera is just driving me nuts right now, and I need to fix it because it's not at the right angle that I want. I don't want to turn you guys off. One more shot here. We're going to go. Just messing with you guys today. So yeah, just taking all those opportunities, and I have made myself a phenomenal career out of just that community college certificate. And that's one of the things I love about medical coding is it's not something where you have to have your bachelor's degree, you have to have a master's, you have to have a certain formal training. There are a lot of opportunities that you can take without having to pay $20,000, $30,000, $40,000, $50,000 for a degree program. I'm getting a question here. Are there any free CPC practice questions available? If you check CCO, I know CCO.us has a few practice examinations that they do offer for free. They are smaller ones, maybe 20. The other option, not necessarily free, but I do have one that is available for a very reasonable fee on my website. So if you go to contempocoding.com and then courses, I do have a CPC practice exam and review. So right over here, $29.99 is extremely reasonable for a practice examination and review. So it's 8 hours on-demand review, and then the practice examination with rationale is included. So if you're ever interested in that, you can check it out on my website, contempocoding.com. There's even a little free preview here that you can play to see what it's going to look like for the review class. It's gotten great reviews. I think they are down here. Maybe some of them. No, maybe not. But yeah, lots of great feedback about how helpful that review has been. Also, there's some reviews that I've been doing periodically on the website as well. So they are all in a playlist as well if you need some review for your CPC exam. And here it is, Medical Coding CPC Review. So again, nice, big, fat, bingeable playlist that you can watch of all of the different content that you can just refresh on before sitting for your CPC exam. I know, how cute is this, right? I love DuckTales. I used to be a huge Darkwing Duck fan girl back in the day too. Sweet Smiles is asking, how many CEUs do medical coders need per year? It depends. It depends on how many certifications you have. And I can show you where it says it on the AAPC website. Let me just quick log out real quick, I don't want to show you guys all of my CEU information, my personal CEU information. But let's see here. I know there is information, education. Okay, here we go. Under education, there's a whole section here for continuing education, and that's about CEUs. So let's see what it says here under continuing education, information for members. So for one certification, for the AAPC, you need 36 CEUs every 2 years. If you have 2, you need 40, 344, and then it continues to go up from there. And then it talks about there are some specific CEU requirements for certain credentials. So for example, if you're a CPMA like I am, you need to have at least 16 of those CEUs related to auditing. Speaking of CPMA, in case you haven't seen yet, I also launched my CPMA course online. So under my website, what the heck happened there? That's not right. Let's go back. Oh, gosh. Uh-oh. Hope the website didn't just crash. That's weird. Nope, apparently it was just a glitch. Okay, so under the courses, the Certified Professional Medical Auditor course is now available. So if you are a current medical coder, you're looking to make that next step into advancement to advance your career, get into auditing, which is a great step. You can sign up for the CPMA course. It is $499. It is 100% on demand, so you can have access for it as long as you need it. I don't make you pay for extensions or any additional fees. If you want an ebook study guide, I offer the ebook study guide for an additional $60. Otherwise, you can purchase the paper one on the AAPC. And there is a coupon code. So if you listen to my live stream, you know the coupon code CPMA20, and that'll take 20% off of your purchase. Jennifer's asking, does your E&M coding course also go over ED physician and E&M coding? So what my course does that I have for evaluation and management coding is it talks about any E&M service that you have to level. So it talks about how you determine the level of history, how you determine the level of examination, and how you determine the level of medical decision-making to come up with the determination. So that will fit for skilled nursing facility, for inpatient, for ED, for all of those where you require history exam and medical decision making. And then it also includes the 2021 guidelines for those office and outpatient codes. Well, NHA, where I got my certification from, except my free CEUs, that I'm not aware of. I don't do a lot of work with the NHA certifications. I know they're very popular amongst certain schools because they have partnerships with a lot of the schools to say, hey, we can credential your students under our billing and coding program, but that's not a credential I've personally sought out. So I'm not familiar with their particular requirements for CEUs. I know AHEMA will accept all of AAPC's CEUs, but it doesn't work vice versa. AAPC does not accept AHEMA certifications, or CEUs rather. Aquels is asking, I'm thinking to enroll in a medical coding online course. I have no background in medical. Will it be difficult? Thanks. So I got into medical coding without any medical background whatsoever. There are some difficult things. I took 3 terms of med term, and my 3rd term of med term was a little bit more difficult than those first ones. It was a lot of memorization. My instructor was not the most engaging. She basically wrote 10 medical terms on the whiteboard every day. She had us write them down like 5 times over, and then she made us take a quiz. So it wasn't, there was no books, there was no anything like that. There's a lot more resources out there available now. And of course, you can always come back to my channel. I have lots of videos to help you out with things like MedTerm, with things like guidelines, with things like reviewing certain sections of the AAPC CPC curriculum, just kind of doing a refresher. Quells, thank you for subscribing to the channel. Greatly appreciate that. So I'm always here for you if you need some additional support with all the videos that I have on my channel. So will it be hard? There's probably areas that are going to be hard, but anything worth doing is going to be difficult. I was watching a live stream earlier and they were talking about practicing essentially and how, you know, you may pick up a guitar with the inspiration, I'm going to become a rock star. But just because you're not good at playing the guitar for the first month or 2 doesn't mean, oh, this is never going to happen and I should quit. Like you keep having to practice and practice and practice in order to meet that goal of becoming a rock star. Same thing with medical coding. You can't just open up your books and if you're not immediately good at this, be like, oh, well, you know, forget this. I'm done. I'm not destined to be a medical coder. You have to keep reading materials. You have to keep studying. You have to keep at it because it really is a practice makes perfect type of scenario. You have to keep practicing at it. You have to keep honing your skills until you can become that expert, until you can get certified and you can make very lucrative careers. You know, with medical coding or with any industry right now, you're going to hear a lot of negative comments. You're going to hear a lot of, I did this and I can't find a job. You're going to hear that about medical coding. You're going to hear that about English degrees. You're going to hear that about people that went into careers for marine biology, but they're in a landlocked state and they don't want to move out of it. Well, obviously you're not finding a job. So don't get discouraged when you see people say like, oh, it took me a while to find a job or I had difficulty finding a job, because no matter what, no matter what career path you take, you're very likely to encounter that. So why not go for a career path that's something that you think you're going to enjoy, that you find fascinating, and that you know is going to have a very good career ladder for you, right? I'm someone who started out with a medical coding certificate from my community college, wound up getting certified as a medical auditor, publishing articles, serving as a chapter officer, now serve on the chapter board, speak at local events, regional events, national events. Now I have this YouTube channel, I have my own business, and I've been very, very, very successful with literally just a certificate from my community college. Gracie is asking, Hi, Victoria. I graduate with a associate's in medical billing and coding in October. Should I sit for the CPCA and then do practicode, or enroll into practicode first and exam for CPC? It depends. I've heard some people say that it gets a little overwhelming if you try to toggle both at once. I think since you're not certified yet, I would really make that your first goal, because if you do your practicode but you don't get certified, that's going to be an issue more so than vice versa. So I would focus first on studying for your exam, making sure that you're going to pass your exam, get your CPCA, and then work on your practicode. Excuse me. So for those of you that might not be aware of what the practicode is, the practicode is a program that can help you remove your apprentice status. So if you go into medical coding, you get your CPC, but you don't have any experience in medical coding, you don't have formal education, you don't go through practicode, you'll be designated as an apprentice coder. If you don't submit any paperwork in advance proving that you have field experience, etc., you'll automatically be designated as an apprentice coder. So you sit for the CPC, but you actually get a CPCA, which designates you as an apprentice coder. They also have the apprentice designation for the outpatient coding certification, COC. Those are the only two certifications that the AAPC has that have an apprenticeship designation. So in lieu, though, of 2 years of experience, which will eliminate that apprentice designation, you'll be a full-fledged CPC or full-fledged COC, you can do two things that will each remove 1 year off of that 2-year experience requirement. One of them is have 80 contact hours of an approved program through a college or university, or can prove through a letterhead that you had at least 80 contact hours of medical coding education. The second thing that you can do to remove a year off is do this practicode, which is a whole ton of redacted medical cases, and you have to code them. It's not multiple choice. It's literally just fill in the blank. Here's 8 different blanks. It might be 2 codes. It might be 6 codes. Just code it, and then we'll tell you if it's right or wrong, and then you have to go back and try again if you got it wrong. There is a kind of, I don't want to say a sneak preview because I don't show you the actual cases because they're proprietary information, but I do have information on the website about practicode if you're interested more about that. So most coders will get their certification first and then do their practicode, so they can just focus on one task at a time. First pass the exam, then do practicode. I have heard that some coders have kind of done it along the same time as they're doing their programs. A little bit more difficult, but yeah. So here's the video that I have if you're interested in seeing kind of what practicode is about, or if it's something that you're interested in, you can definitely check it out there. Arun is asking, can you please tell me about the salary package for CRC coders in my state, in Pennsylvania? Off the top of my head, I'd say average is probably in the 50,000 a year range. But that really depends on the facility, on the particular project, a lot of different factors. There is some AAPC salary information you can find on their website. I think the salary calculator might still be down, because last time I checked, it just loaded and loaded and loaded, and it looks like, oh, wait, hold on. Oh, it's back up. Yes. So if you're interested in the medical coding salaries, you can go to the medical coding salary calculator that the AAPC has. You can just go into Google, type in medical coding salary calculator, and it should pop up. If not, maybe AAPC medical coding salary calculator. And you can search. So let's say in my state, I'm in Pennsylvania. So LMNOP, Pennsylvania. And we're talking about, let's see here, primary certification. We're going for a CRC. Oh, just passed it. CRC. There we go. And it looks like with just those two factors, it's saying the average for a CRC is 63,780. And again, that's based off of AAPC data. So your individual results may vary depending on your years of experience and all kinds of different factors. Nikki's saying, I would like to do medical coding. However, I'm concerned about finding a job. I heard someone say that there are agencies for temporary medical coding jobs. How likely is it to find one that way? So yeah, there are in fact temp agencies where you can go through, submit your resume, and they will be able to help you find jobs through temp agencies. There's coders that definitely have found those jobs that way. There's also some employers that will hire for certain projects, more so in a 1099 capacity, which means you're not going to get benefits or workers' compensation or any of those kinds of things should anything happen, but there will be a higher pay. So you might find some contract work that way too. As far as job search tactics, I have a couple of videos on that as well, but my biggest tip is there's two things you can do. You can go on codersdirect.com, and that is a directory of jobs just for medical coders. I'm pulling it up right now. Here we go. So codersdirect.com is specific for medical coders that are looking for jobs. They have places where you can search. So you can search the job directories. They are also down here. You can kind of see some different things that they have available. You can search specifically for remote positions if that's what you're looking for. You can also submit your resume and have employers look for you. But there's also a lot of other job search tactics as far as looking on Indeed.com. So you can search Indeed.com, search for things like CPT and ICD-10-CM, because that'll pull up the jobs that are looking for those skill sets, not necessarily just medical coder positions. And there's a lot of other job search tactics videos that I have on the website as well, where I talk more in depth about how to do your resume, where I talk about interview tactics. And if you're actually looking to get your resume done, check out projectresume.net. They do resumes specifically for medical coders. So if you're looking at, if you're just finishing up and you're like, oh, I need to redo my resume and I need to highlight all of the things that employers are going to look for as someone who's just entering the field and I don't know what to highlight, what are the things that I need to have on here to have them when they're searching through the database, pull out my resume. Project Resume can definitely help you out with that. They are fantastic. Let's see what else. Christina's asking, so if I have formal education, will that remove my A from my CPCA? So that will be one part of it. If you have 80 contact hours and you do practicode, that will remove your A. So it's those combination of those two things. Or if you have 1 year of experience and you had 80 contact hours of formal education that you can have proven on a letterhead or stationery, that will remove your A as well. But just the education alone will not be sufficient to remove your A. If you look on the AAPC website, they do have all the information on there about all of the criteria that you have to meet in order to remove that apprenticeship designation. And they title it here, Goodbye to Your A, and they talk about what kind of proof you need to submit and to where. So the emails and all of that information is accessible there. Did I miss Marissa Lynn? Where is she? Where is she? Where is she? Oh, Lily C. Thank you for subscribing to the channel. Greatly, greatly appreciate your support. And if you haven't subscribed to the channel already and you need more information about medical billing and coding and the industry and guiding you through some of those certification exams, definitely make sure you smash that subscribe button and don't forget to hit the like button as well. Fashionably late, Marissa. Fashionably late is what you are. She's here. So we have a comment here. I recently got my results passed with an 83%. Your videos helped me a lot. Thank you. Congratulations on becoming, I'm assuming the CPC, right? So congratulations on your certification exam passing. That is fantastic. And I am super excited for you. Make sure that you continue to watch the channel because, again, I have lots of video tips on how to stay updated on your guidelines. Those guideline updates are coming up soon. The ICD-10-CM code updates are coming soon, not just the guidelines, but the codes that are updated themselves. If you're interested in other certifications, I have CRC, I have CPMA certification prep. So lots of still reasons to stick around even after your certification. I feel like I'm missing some of the comments here as they're just flying through. Yeah, you know what? It took me a while to get a hold of vaccine administration too. And I think I do have a video, it's an older one, about the different administration codes, because there's some nuances that I didn't even discover until I started working more in depth in reviewing some of the vaccines. Like that, if it's a pediatric patient and you don't have proof through documentation that the counseling was performed, you can't utilize those codes because those codes require the patient to have been counseled on the administration of those vaccines. It's actually surprisingly an easier process than it used to be on ICD-9, because in ICD-9, instead of just having the Z23 code where it's administration of an immunization, we used to have different diagnosis codes for each specific one. So there was a diagnosis code for Hep A, there's a diagnosis code for flu, and you would have to match the diagnosis code to the administration and then the medication code as well. And you would just absolutely go cross-eyed. So believe it or not, it's actually a slightly easier process than it used to be. Ken Chan saying, can you advise on CPC practice questions? Where can I purchase CPC practice questions? Yeah, so there are a handful of different ways that you can get them. You can get them on the AAPC website. So let's go back to the website. If we are going to, let's see here, certification, CPC, they have lots of different practice examinations broken down into 50 segment chunks. Let's see here, prepare for the exam. Practice exams, here we go. So there's different bundles. None is any better than the other. So it doesn't matter which one you get. If you want to get the ABC bundle or the DEF, they are just randomized questions. One is not better than the other or worse than the other. They're all equivalent. So you can buy just one individual. That's 50 questions for $39.95. You can also get CCO.us has a free practice exam. I believe it's only about 20 questions or so you can check that out there. I also have one available on my website, contempocoding.com. I have a CPC review and practice examination. That is $29.99. It's 150 questions and comes with an on-demand 8-hour review session. I also have one for the CRC as well. I think the practice exam, though, for CRC is only, I think, 50 questions long, though. Oh, there's also some books on Amazon that have practice exams. But when I've purchased some of the Amazon ones in the past, I've not found them to be incredibly accurate or geared towards really what the content of the exam is. They may have improved by then, but that's another place you can check, is you can check on Amazon for some of the Kindle digital downloads for practice examinations. Where can you get an electronic book? So there's really only, if you're, I'm not sure if you're meaning a free electronic book or a paid, because those are two different things. If you're looking to get a free electronic book, the only one that you can really access for free is ICD-10-CM. You can find that on the CDC website or the CMS website. There's a video that I have where I talk about how to combine them into one giant PDF. As far, though, as electronic books, because of licensing and copyrights, you would have to pay for a CPT book. You'll have to pay for a HCPCS book. Any textbooks and workbooks you will also have to pay for as well because of the licensing and copyrights involved. I'm about to start on the circulatory system in ICD-10-CM. Do you have any tips for this portion? Absolutely, I do. And I feel like I'm just referring everyone back to other material today. Yeah, so circulatory system information I have on the website. So if you go to the main channel website here, on my medical coding review, I do have a section here for the circulatory system, and that is right here, cardiovascular. And that's the one that you want to check for all the tips and information that I have pertinent for that particular section. Also, the ICD-10-CM guidelines. There is one for the circulatory system right here as well on the main channel page. And again, if you haven't already, don't forget that I do have channel membership out there. So if you're interested in supporting me and the channel, I do have different membership tiers available from $1.99 to $9.99 a month to help support me and the channel and all the materials that I provide for you guys on YouTube. At the $1.99 level, you get access to custom emojis, community-only posts, and then the gold and platinum membership, you actually get your name added to the end credits of my videos. Platinum, you get extra footage and material. Am I familiar with international medical coding opportunities? Not particularly, because I am based in the United States. All of the jobs that I've had to apply for, I've applied for within the United States. I know that there are jobs out there that they will allow you to work from Pakistan, India, Egypt, the Philippines, but as far as what those agencies are, I know Harmony Healthcare does some. I can't remember if Kiwi Tech still does. So they are out there as far as specifically how to direct you to those job opportunities, what companies will allow international coders. I'm not certain about that entire process. Yeah, Marissa Lynn, you get cool colors too. After getting the CPC, what certification should I go for next? So I feel like I should make one of those little grids like they used to have in, teen 90s magazines. Do they still have those in ladies magazines as well, where you like follow the little roadmap and it's like, do you yes or no? And then you kind of follow through and it tells you what certification to do next. My top two picks, I will tell you my top two picks after you get your CPC certification. Number one is your CRC certification, and number two would be your CPMA. It depends on what your interests are and what your long-term goals are, but those are the top two I would recommend. Possibly also the CPB, depending on your circumstances. So let me talk through how you would decide. So let's say you're brand new to healthcare in its entirety. You worked in retail or you worked in entertainment. Now you're getting into medical coding. You passed your CPC. You're like, I need to find a job. If you're having trouble finding a medical coding job, you might want to get your CPB because it will widen that net of opportunities you have. You can get into pretty much anywhere in the revenue cycle with the CPB and the CPC. CPB is your certified professional biller. So if you could do billing and coding, you can apply for insurance jobs. You can apply for payment posting, coding, basically anything within the revenue cycle. CRC is your certified risk adjustment coder. So if you really, really love ICD-10-CM and you specifically want to work in jobs where you just have to work in ICD-10-CM, which isn't that a great idea because then you don't have to worry too much about CPT or HCPCS if you don't like those, go for your CRC because that primarily focuses on ICD-10-CM, knowing your ICD-10-CM guidelines, and you'll just get to work with that code set. If you want to progress into an auditing role, if you're looking to climb that ladder and go, hey, I want to get into an auditor role, which I'm going to actually be doing a video. It's almost done where I talk about the perks of being an auditor. And some of them are things like you're usually salaried as an auditor. You have a little bit more flexibility. You have better pay as an auditor. You're seen as a little bit more of an authority. So if you're interested in climbing that ladder, the CPMA credential would be a good one. You also have to understand, though, that as a medical auditor, you may have more of a hands-on role with providers. So not just coding, but also looking at what a provider or a computer may have coded and your interpretation of what the code should have been, why that code that was originally selected and built out didn't meet the certain criteria, the rationale behind it, the references, the resources, sitting down with that provider, hashing out and talking to them like, hey, I know that this is what you want to bill, but that's not what you documented. It didn't match up, and having some of those more difficult conversations. Most, not all, but most auditing roles are not just, I make the audit, I shuffle it off, and I'm done. It is also following up and having those communications as well and developing reports. So depending on what your career goals are, those are the ones that I would suggest, either your CPB, your CRC, or your CPMA. Can you please offer a video for a job-related website? So I do have a video for that. Let me see what I got here. I have one where I talk about Coders Direct, and I talk about, here we go. So this one here that says how to find a medical coding job in 2021, that is the video that you're going to want, because that talks about Indeed, it talks about LinkedIn, it talks about strategies, resumes, it talks about codersdirect.com, and all of the different tips and tools that you need in order to find a medical coding job. Did you talk about the AMA CPT code, ICD-10, and HCPCS codes for 2022 and where to get them? There's two places I would recommend. Either get them through the AAPC or get them through Optum 360. Oftentimes you can get pretty good discounts with Optum 360. The one thing I will stress upon when I talk about medical coding books and purchasing books is keep in mind that if you're sitting for any AAPC certification exams, you are going to need the current calendar year books, ideally. So if you're not going to sit for your exam until 2022, you're going to need the 2022 books. You can still use 2021 books. Hey, thanks, Jamie Kim, for the super sticker. Greatly, greatly appreciate your support. So if you're sitting for your exam in 2022, you're going to want 2022 books. You can still use 2021 books, but if there's some questions in there that have changed based off of the updated codes, you do risk possibly having outdated information. But I would check Optum 360. The other thing I want to mention is usually around this time of year, I start getting questions about specifically my CRC course, since it's just ICD-10-CM. ICD-10-CM updates on October 1st of every year. The AAPC exams will not update on October 1st. They update January 1st. So in that time frame between October and January, you cannot use next year's books. You have to use your current calendar year's books. And the exam will still be based on that current calendar year, because the exam itself will not update until January 1. So they're still going to test you on all of the 2021 material throughout the end of this calendar year. The exam will not update for any of those new ICD-10-CM code updates until January 1. As far as, do we get rid of code books once the newer version comes out? You can if you want. I usually keep a couple prior years just in case. Sometimes, depending on what you're doing, you might have audits or you might have old cases that you come across that you need to look at some of those books. I usually keep maybe 3 years worth and then get rid of them. And the other consideration is if you have a encoder program, typically you can backdate them. So if you're looking up a code from a case from 2019 and you type in that code, you can set to your encoder to say that is 2019, and it will tell you if that was a valid code on that date, et cetera, what the NCCI edits and all that were. So if you have one of those programs and you don't necessarily need those books, you might want to get rid of them. Maybe only keep like 2 years worth. Oh, I'm so glad that you commented again about the Optum 360 books, because that was the other thing I wanted to mention. So with the CPT book, the only version of CPT that you are allowed to use for your AAPC examinations or your AHIMA examinations is the AMA version. You may find different types of CPT books. So let me just bring up the Optum website and see if I can show you. Because you're only allowed the AMA edition. So let's see here. If I can find those. Okay, so if we go on the Optum website, here's a bunch of different CPT books. Current Procedural Coding Expert, all of these ones, these purple ones, they are not permitted for the exams. You might want to use them in your day-to-day coding activities because they have different appendices, different regulations and things, but they probably won't have the official AMA CPT guidelines in them. Usually those are just reserved for the official AMA edition. So these editions are not appropriate to be used at the exam. You want the AMA edition. Let's see if they have it here. These might just be the Optum versions. Let's see, code books, CPT. Yeah, so this one here. This is the AMA edition. This is the one that you need if you're sitting for any certification exams through the AAPC or HEMA. I am way ahead of you. I am actually working on that right now. Still scripting it out because I'm debating if I want to put through some like practice cases in it. But that video is planned. It just needs to be fine-tuned and then recorded. And again, I'm still kind of contemplating if I want to put some practice cases in it or not. But yeah, I have that. And I actually have a whole webinar that is about 95% done, talking about the secrets of successful auditors. It's already approved for one CEU, and that's going to be on demand. That should be coming out shortly as well. And if you're interested in CPMA training, I do have CPMA course on my website, contempocoding.com. It is $499. It is 100% on demand. You do not have to pay for extensions. You will have access as long as you need. And if you use code CPMA20, it will take 20% off the course, and there are installment plans available. So the tabs have to come with a book and cannot be homemade. That's what it says on the AHEMA information. So AAPC and AHEMA have two different regulations as far as tabs. So let me see what I can bring up real quick on the AAPC website versus AHEMA. So if you go to the AAPC website, as far as your certification FAQs with the tabs, what's allowed in our books, it says tabs may be inserted, taped, pasted, glued, or stapled in the manuals so long as the obvious intent of the tab is to earmark a page with words or numbers, not supplement information in the book. That's a little bit different than what AHEMA has. Let's see if I can find the AHEMA because their terms are a little bit different. Let's see if I can find it. Candidate guide, that's what I'm looking for. Candidate guide for AHEMA. They have slightly different information on what the tabs are permitted. So if we look at the candidate guide for AHEMA, oh, yeah, here we go. So here's their candidate guide. So I'm going to do a Control F and look for the word tab. And they say here, let's see, tab. Let's see here, establish. Yeah, under test center restrictions, it says no homemade tabs will be allowed. And I can zoom that in so you guys can see it a little bit better. But that's what it says on the AHEMA candidate guide for their exams. No handmade tabs will be allowed. So my interpretation of that is the ones that come with my book are probably permitted. It's just that I can't hand make them. I couldn't use like these little guys here and homemade my tabs. But to me, I interpret that as the ones that come with my book. That these would be permitted because these aren't homemade. They literally came with the book. But I've not taken an AHEMA exam, so I'm not 100% certain on that. But based off of literally what it says in the candidate guide, that's what my interpretation of that is. So if you just go into Google and type in AHEMA candidate guide, you can get access to this document as well. And they do have also here the directories of where to go for the list of allowable books for these specific exams. I know they did just change effective, I think the 1st of this month, that now the AAPC versions are permitted, and that is on their website. Let's see if it takes us here. Yeah, so if you're taking any AHEMA exams, they do have the acceptable book list here and talks about when the books are going to go into effect in relationship to the examinations. Yeah. So Carmen, I would check with, if you're going for an AHEMA exam, check with AHEMA. AAPC will absolutely allow homemade exams. So there's a difference between the AAPC regulations versus the AHEMA certifications. But yeah, what AAPC basically says is you can take a tab, you can take some sort of tab, you can glue or staple or paste the tab in, but you can't glue or staple or paste extra pages in. Or I know some books come with those tabs that are like a full sheet. You can't take that full sheet and write all kinds of extra notes then on that. So it depends. Sometimes, just like Elizabeth is saying, AHEMA allowed her to use those tabs for her exam. I bought and made mine. Maybe it depends on the exam center, but I'm just going off of what they say on the candidate guide, and on the candidate guide, it says no homemade tabs. So a little bit confusing. I would always make sure that you're just double checking with your exam center, call them directly and see what they say. Cause Elizabeth is saying she got through with her homemade tabs. I don't know. I've had other people say that they took the exams with books that aren't on the approved books list too. So it might just be a luck of the draw thing. Who the heck knows? Da, 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 da. All right. Carol is saying, I have the CPCA and CRC. My goal is to get the CIRCC and code interventional radiology. Yeah. That's some money in intervention. You must have watched that interview I did with Kyle Johnston, where he said, when I get a good IR coder, I will that they're like platinum level coders and that everyone wants them. So right now you're in the AAPC CIC course. Do you think getting the CIC will help me towards my journey in IR, or should I focus on practicode, or what? I don't know that necessarily the CIC will help you out. The CIRCC, I think, I don't know if it involves facility coding, but I do know that the best resource that you're going to want for interventional radiology coding is actually Stacy Buck, and I have a link in the description to her course. So she is the expert in interventional radiology coding. Stacy literally wrote the book on interventional radiology coding. Okay. So if you're looking for interventional radiology coding, radrx.com, I have a link in the description of the video with a discount code for some of her products for her book and her interventional radiology coding training program. So everyone, we actually topped, believe it or not, this live stream topped, I think, all of my live streams in the entire time. 76, I believe, was the highest I saw it going. Tons and tons of people coming in, very excited. I think it's because community colleges are starting up soon. A lot of students probably coming in. Let me see here. Mariette, you are the last question I am taking today. Worked as a billing and claim specialist for 2 years in the insurance department of a FQHC. Have my associates in health information technology. Took the AAPC course online. Will I be certified as a CPC or CPCA? Excuse me, 1 second. So, based off of the information you have, you will probably be a CPC and not designated as an apprentice, but you have to submit that proof. If you don't submit the proof of your experience and education prior to sitting for your exam, you will automatically be designated as a CPCA. At that point, you can submit the information to the AAPC for them to review. The criteria is 2 years experience working with codes. That doesn't necessarily mean your job title has to be medical coder. It means you have to work with ICD-10, CPT, and possibly HCPCS codes on a basically daily basis, working with the codes in some capacity. It has to be from an employer. There has to be certain criteria met. You can check the AAPC website on how to remove your A, and they will talk you through the different criteria that is available there. My comments just jumped. So once you submit that information, if you're automatically designated to CPCA, you submit that information. They say, hey, your apprentice designation is now removed. They will send you a new certificate in the mail. So you'll get one that doesn't have the A on it. And then you are officially a CPC. So it sounds like you will meet the criteria to not be designated as an apprentice. But if you don't want to ever have that apprentice designation, you have to submit that in advance of sitting for the exam so that they know to give you the full CPC credential, not just the apprentice designation. Yeah, so the link for the interventional radiology, it should be in the description of the video. It's radrx.com. And the coupon, I believe, is Contempo 10. I'm going to put that in the comments here. Oh, it didn't. Tempo 10, hold on. My number lock is stuck. But yeah, radrx.com, coupon code is Contempo 10, and that is the one that I have. That's a discount on some of her products that you'll want to use if you're looking to get that CRCA credential in interventional radiology. So thank you guys for hanging out with me on another amazing Saturday for a great live stream. It was great to provide some feedback to you guys today about the exams, about the tabs, about interventional radiology. So yeah, radrx.com is definitely the site you want to check out for that. And there's a coupon code in the video description. I will see you guys in the next video and at the next live stream. And until then, just keep on coding on.